Okay, so today I will be talking about hemophilia and how a small change can make a super big difference in someone's life. In this presentation, I will cover the basic science of hemophilia, including chromosome location, the mutation of the DNA, protein information, and then I will talk about symptoms, pathology, and the prognosis, which includes who's affected, the life expectancy, and how it's passed to offspring. And then I will discuss genetic medicine and what genetic treatments are being used for hemophilia patients. So first up, we have the basic science of hemophilia. And so it is a rare X-linked chromosome mutation of the genes involving coagulation factor 8 and factor 9. And so the severity is determined by the level of factor 8 or factor 9 in your blood. So if you have less than 1% of this protein, then you have severe hemophilia. And if you have 1 to 5% of this protein, then you have a moderate factor. And then greater than 5 but less than 40 is a mild, and 50 to 100% of factor 8 or factor 9 protein is normal blood. And then there are two types, and so the distinction is not necessarily important, but it is important for what factor you have. So classical hemophilia is type A, which is much more common than type B, affecting 1 in 5,000 males at live birth. And then type B is called the Christmas disease, and it affects 1 in 20,000 male live births. So it's less common, but your symptoms and your signs are relatively the same. So this is some more basic science. So when you have hemophilia, the body does not produce the protein necessary to form a blood clot due to mutation with factor 8 or factor 9. And so some people's mutations insert base pairs while others will delete or insert multiple base pairs, which means there's not really any consistency with how your mutation is going to occur. But it is most common that you have inversion or your DNA is rearranged. And so this causes an abnormal version of factor 8 or reduced amount of the protein in your blood. And so I think it's important that in severe hemophilia, it almost eliminates the activity of coagulation factor 8, which means it's basically non-existent or able to function. And so a reduced amount of activity, it would be your mild or moderate hemophilia. And then hemophiliacs often develop inhibitors, which makes it more difficult to stop bleeding and prevent treatment. And it prevents the treatment from working. So this means that an inhibitor essentially becomes immune to the treatment that you're taking and makes it so that your blood continues to not clot. And then on the left, I have a pedigree chart of how each person would be affected. So now I'm going to talk about some pathology. And so the significant signs and symptoms of hemophilia would be bleeding into the joints, which would be visible via swelling, pain, tightness in your knees, elbows, and ankles, excessive bleeding in the skin, which would be bruising or hematomas, like the picture on the left, that is a subdural hematoma, and then bleeding of the mouth and gums. And so this is much more noticeable in kids because they will lose their teeth and they will not be able to stop bleeding, or bleeding after vaccinations, particularly at annual vaccinations as an infant, bleeding into the head of an infant or after a difficult delivery, and blood in the urine or stool, and frequent and hard to stop nosebleeds. Once again, these signs and symptoms are much more noticeable in children just because it presents much earlier and it'll be much more noticeable. So the prognosis, I think it's important to mention that mostly men are going to be affected by this disease, largely because it is a mutation on the X chromosome. And so they are much more at risk to developing this mutation, but it can still occur in women, though it is rare. So life expectancy with Western and developed medicine, life expectancy is approaching that of a normal and average male. And so it's still around 75 years old, which is the average life expectancy. And it is passed on via the X chromosome. So women are often carriers, but it is common that men will develop the disease. But it can develop from spontaneous mutation, but that is much less common. About 2/3 is hereditable and 1/3 is developed via spontaneous mutation. and it is located on the subtelomeric region on the human X chromosome at the flanking fragile site XQ27.3, and on the right you will see the yellow arrow indicates where this is located on the X chromosome. So now I'm going to talk about some treatments and some genetic medicine being used today. So there are two main types of clotting factors concentrates available, and one is the plasma-derived factor concentrates, which is collected from many people, and then it's filtered and screened for viruses. It's separated into its components like the clotting factors, and then these clotting factors are freeze-dried and can be used as like a powder or an injection to treat hemophiliacs. And then you have recombinant factor concentrates, which are developed via DNA technology, and they're essentially engineered DNA. And they do not contain plasma or albumin, so they cannot spread blood-borne viruses. And the first plasma-derived factor concentrate is much newer than recombinant factor concentrates. So some of the drugs that are available for hemophiliacs is Haemophilia, and this replaces the function of factor VIII and can be used to prevent or reduce the frequency of bleeding episodes in people with hemophilia A. And then you have DDAVP or stymate, which is essentially a hormone mimicker, and so it releases factor VIII from where it's stored in the body. And so due to the severity, it would be much more efficient in people with mild or moderate hemophilia. And then you have Amicar, which is given by vein or mouth, and it prevents clots from breaking down. And so it's often used for bleeding in the mouth because it will block your saliva from breaking down the clot. Or chiroprecipitate, and this is a substance that results from thawing the frozen plasma rich in factor VIII, and so it's commonly used to control serious bleeding. And then here are my sources. Thank you.